than having privileges to perform anesthesia, yes.
And there's different requirements for monitoring with respect to the differences with respect to anesthesia and conscious sedation, isn't there?
For procedural sedation, there are very specific requirements for monitoring. I am not an anesthesiologist. I do not work in the operating room. I do not perform anesthesia, and so I'm not qualified to tell you what their requirements are.
Are you familiar with blood levels, toxicology numbers that will be achieved upon use of certain amounts of medication?
No.
Beyond our area of expertise.
Sustained. Partial answer is stricken. Please disregard it.
So if a person is given a certain amount of propofol, would you be able to tell what their blood level was?
Objection. Beyond the scope. Beyond the
Sustained.
Now, in your use of propofol and for procedural sedation, what types of what amounts of propofol do you use?
It will vary case by case.
Okay, it depends on the individual size.
Yes.
And does it also depend upon the level of sedation you're trying to achieve?
In general, once I make a determination I'm going to perform procedural sedation, I will choose a dose that will, in general, make patients comfortable and not be completely alert or aware so that we can perform whatever painful procedure needs to be done. So in general, our goal is to have about the same level of sedation for most procedures.
Okay, do you ever vary the sedation level for a procedure that you do?
Yes, probably.
You ever used propofol as a pre-med prior to doing a procedure?
No.
Now, if I were to give you a hypothetical that 25 milligrams of propofol was slowly infused over a 3 to 5 minute period at 10:40 with 25 with also 2.5 milliliters of lidocaine, would you have an opinion as to how long that would last?
It would depend on the patient.
On a patient, say the size of Michael Jackson, about 135 pounds.
And he received no other medication.
Right.
I would think it would be, in my practice for procedural sedation, I couldn't imagine I would give a dose of 25 milligrams to an otherwise healthy 60-kilogram male and give it over 3 to 5 minutes, because I would not expect that would produce any level of sedation for me to achieve the procedure I wanted. But if it did achieve sedation, I would expect, if he didn't have any medical problems, 7 to 10 minutes, it would probably be worn off.
When you say worn off, what do you mean?
I would expect that I would not have, if I had achieved sedation, I would suspect that sedation would be completely resolved within about 7 to 10 minutes.
Would that mean that the propofol would basically be out of the bloodstream?
I don't think that that would mean that the propofol would be completely metabolized, but the sedative effects that I would be concerned about and the sedation level would not be a concern at 10 minutes.
How long do you think it would take for it to be completely metabolized?
Objection. Beyond the scope, beyond our area of expertise.
Sustained.
Now, when you say you're not even sure that would achieve, if there's no other drugs in the system, that might not achieve a level of sedation. Is that correct?
That's correct.
So is what you're saying is that 25 milligrams is a very small amount of propofol to give a patient?
A 60-kilogram male, if I wanted to achieve sedation so that I could perform a painful procedure,
Yeah.
25 milligrams would not be a sufficient dose in most patients.
But it might be enough to put a person to sleep?
I don't suspect so, but I don't know. I do not use the medication in those types of doses.
Okay. Now, Dr. Murray informed you that he had given lorazepam, is that correct?
That is correct.
And he told you 4 milligrams?
He reported he gave him 2 milligrams, and then at a later time gave him another 2 milligrams, and at the time of just before the arrest.
Did he tell you what time he gave the lorazepam?
I did not get a specific time, no.
Did you ask for a specific time?
I did not explicitly ask for the exact time.
Would the time of the lorazepam matter?
What do you mean, would it matter?
Well, would it matter as to whether or not it's having an effect on his body at that time?
At the time Mr. Jackson was my patient, he already had been dead for some time. The dose of the medication was reported to me as being, the last dose was given at the time that Dr. Murray reported he witnessed the arrest.
Okay, when you asked about the medications, were you trying to determine a cause of death, or were you trying to get information necessary for purposes of treating Mr. Jackson?
The information I had about the lorazepam was provided by Dr. Murray when I asked what happened and was trying to obtain both the patient's medical history as well as the events surrounding the arrest so that I could treat Mr. Jackson.
So you wanted to know the information for purposes of treatment?
Yes, Mr. Jackson was my patient and I was attempting to treat him, yes.
Okay, you were looking to determine a cause of death.
I was looking to determine what may have caused the death, just the same reason I asked about past medical history and medical complaints, because I use that in my decision-making in determining if there was something that was or was not done during the resuscitation that I should do.
Well, when he's treated with lorazepam, would it make a difference whether it was treated, whether he was given the lorazepam that morning or the following or the previous day?
Matter in terms of, I'm not sure what you mean in terms of matter.
Why did you ask what medications were there?
I was attempting to resuscitate Mr. Jackson. So in my mind, as I am running the code, I am thinking of all the causes for why a 50-year-old male would be suddenly dead, so that I can then decide what treatments we should consider.
Okay, so the medications are important to know, but the time of those medications is important also, isn't it?
Most of the history would be important. That is why I asked Dr. Murray for information.
But you never asked him about the time, did you?
No.
Okay, so if he gave lorazepam the day before, it wouldn't matter at all, would it?
I don't know what he did the day before. I became Mr. Jackson's doctor when he arrived in the emergency department, and I was asking for a medical history.
No, I'm going to allow the witness to finish. The
Okay.
objection's overruled.
Okay.
You may answer it, please.
The medical note that I wrote is the story of the care that I provided and the information that I had at the time. I asked Dr. Murray standard, simple questions that I would ask of any medical professional if I was taking care of their patient.
You determined what the medication was that had been given. Is it your testimony that the time that it is given did not matter?
I don't believe I said that that was my testimony, no.
No, you didn't. I'm asking you if it did matter.
It may have mattered, yes. At the time I was taking care of Mr. Jackson, I didn't know why he was dead, so I wasn't sure what mattered. That's why I asked for all of the information that I could have.
But you didn't ask about the time, did you?
No, I did not explicitly ask for the time.
And what I'm asking you, does the time matter?
Objection asked and answered about 3 times.
Overruled. You may answer the question.
At the time I spoke with Dr. Murray, his report to me was he the last dose, he gave 2 milligrams of lorazepam, observed the arrest, instituted CPR, and called 911. In my mind, I made the assumption, which may be incorrect, that that was all proximate, that he had just received the medicine, he witnessed the arrest, and then the patient shortly became my patient.
Now, you've never testified before that he gave it and then witnessed the arrest right after he gave it, did you?
I believe I did testify to that, and I believe that's what my chart reflects.
Well, if Dr. Murray gave lorazepam 2 milligrams at 2 o'clock and 2 milligrams at 5 a.m., would you still expect that to be into the Michael Jackson system at 12?
And when you say in the system, I don't know what would be completely cleared in terms of metabolites, but a dose of medication at 5 a.m., I would not expect to have as much of an effect at noon.
We're not communicating very well, Doctor. I asked you a question. 2 a.m., 5 a.m., 2 milligrams each time, would you still expect that to be in his blood at 12 o'clock?
Objection, to be honest, beyond your area of expertise.
If you know or not.
I do not know when the drug would completely clear his bloodstream.
Overruled.
Are you familiar with the half-life of lorazepam?
The half-life of benzodiazepines can vary greatly depending on the patient and on how many doses they've had, on whether they're a routine user.
I'm not talking about benzodiazepines in general. I'm asking you if you're aware of the half-life of lorazepam.
I cannot give you the exact half-life of lorazepam currently, no.
If it was given 2 milligrams at 2 and 2 milligrams at 5, would you expect any lorazepam to be in his bloodstream?
Objection. Same objection.
Sustained.
You're not familiar with that?
Objection argumentative. Same objection.
Overruled. Is that a fair statement? That you're not familiar with that particular issue?
I'm not.
Too many variables or whatever else is going on?
It seems to be still related to asking about something in the blood level and the blood system, and I am not qualified to answer that.
Thank you.
Okay. Now, if Michael Jackson was slowly infused with 25 milligrams of propofol at 10:40, would that still be in his blood system at 12?
Objection. Same objection, beyond the scope, beyond your area of expertise.
I think she's testified she's familiar with this.
I'll overrule the objection if you're able to answer that type of hypothetical.
Okay. I think you were asking if something was still in his blood system, and as I said, I do not know the metabolism of the blood, but I would not expect him to still be sedated from that 2 hours later, if that's the question.
Well, you know it wouldn't be in his system, don't you?
Objection, Ms. Stacy.
Sustained.
What type of training have you had with respect to the administration of propofol?
I have been to courses on procedural sedation. I perform procedural sedation. We routinely review articles of the use of procedural sedation.
Okay. And if you were going to do procedural sedation on a 135-pound person, 60 kilograms, how much propofol would you use to sedate them?
So this is a otherwise healthy person who I've already decided is safe to give procedural sedation to,
Yes.
and I've not given them any other medication.
Yes.
About 1 milligram per kilogram would probably be my starting dose.
Okay. And that if you gave him 1 milligram per kilogram, in this case that would be 60 milligrams, correct?
Correct.
How long would it keep him asleep?
If that was sufficient to sedate him, I would suspect the level of sedation would wear off in about 10 minutes.
Okay. How long would it continue to be in the system?
Objection vague. Same objection.
The same ruling on foundation grounds. Sustained.
How long would it be detectable in a blood sample?
Objection.
Sustained. We're going to move to another subject area. Thank you. 350, 352.
Would it be your testimony that you're not... Well, let me ask you about this. Dr. Murray told you that he'd given 25 milligrams of propofol at 10:40.